Thank you for joining us this evening as the AOA presents COVID-19, Cybercrime and HIPAA, Prepare Your Practice. Our speakers this evening are from HIPAA Secure Now, and they are the President and CEO, Art Gross, and the Social Media Manager, Nicole Unruh. They will introduce themselves in a little bit. First, I want to go over some housekeeping. All of the participants are in muted mode. You will stay muted throughout the presentation. Should you have a question, and we certainly hope you do, please type them into the Q&A box found on your screen. We will address any questions after the presentation. If you need help with something or are having some sort of difficulties, please use the chat box for that, and I will respond and see what I can do to help you with that. The slides, the recording, and a special handout will be available on the AOA's website following the presentation. Also, to obtain your CME credit, you must go back and take the post-evaluation, which will be available after the webinar, and that will be available on the AOA Online Learning platform, the address here on the screen. Also wanted to let you know that this presentation is being provided strictly as education, should not be construed as legal advice or anything like that, and that the information was as current as could be on the date the lecture was prepared, which was just updated earlier today. And with that, I will turn it over to Nicole and Art.
All right, thank you, Cindy. And thank you to the AOA for inviting HIPAA Secure Now to participate in our webinar today. It seems our slide is a bit cut off here. I'm not sure what's going on there, so I apologize for that. But we're here to talk to you about COVID-19, cybercrime, and HIPAA, and we'll take a look at how you can prepare your practice for the future. I'm Nicole Unruh. I'm the social media manager here at HIPAA Secure Now. I've worked here for about 4 years, and I started my career here as a HIPAA compliance analyst, actually. And now I have turned into the social media manager, and I use social media platforms to help healthcare organizations understand some of the challenges that they're facing, things I've learned through my career as a compliance analyst. So I'm here today with our president and CEO, Art Gross. Art, how are you?
I am doing great, excited. We have a packed house tonight, so it's good to see. As Nicole said and Cindy said, and thank you, Cindy, for inviting us. I am the president and CEO of HIPAA Secure Now. We have been in business for 10 years, helping healthcare organizations with HIPAA compliance and healthcare security. And we're going to talk about the COVID-19 and some of the challenges, especially around cybersecurity. So with that, why don't we jump into it?
Sure. So I'll just highlight tonight's agenda. We are going to talk about how COVID-19 has created a perfect storm for cyber criminals, how you can fight back against some COVID-19 scams, and then we're going to dive into telehealth and concerns around its use, how to safely use it, and then we'll close out with how to prepare for telehealth changes after the pandemic. So with that, I'm going to pass it to Art to talk about the cybercrime landscape.
All right, so creating the perfect storm for cyber criminals, and if there really is a perfect storm, it is around COVID-19. 2020 has not been a great year for a lot of us, and it's actually been a bad year. We've been dealing with this pandemic and COVID-19 and all of the negativity and negative outcomes of the pandemic. But on the other hand, it has been an absolutely great year for cyber criminals. In fact, if you were a cyber criminal, you probably could not be happier. It is really a pandemic of cyber crime. And it's all around fraud and using COVID-19 and all of the lockdowns and everything that we're going through to pull off their cyber crimes. Just in 2020, COVID-19 fraud is around $120 million of losses inflicted upon organizations, healthcare organizations, small businesses, individuals, large businesses. So that, the impact is large. The FTC has received almost 200,000 reports of COVID-19 scams. That's almost 760 a day. And healthcare is absolutely being targeted. Some of the scams are around PPE, of therapeutics, of vaccines, hand sanitizers, and all of those different topics around healthcare. And the recipients of a lot of these scams are healthcare workers and healthcare organizations. The cyber criminals use phishing and spear phishing, basically very directed phishing and fake emails to pull off their cyber crimes. It's definitely the tool of choice for cyber criminals. And spear phishing has increased almost 700% between February and March. So cyber criminals said, wow, this is great. We have all these lockdowns and we have this pandemic and we have this COVID-19 disease. Let's use it and try to scam unsuspecting individuals. And part of what they try to do with all of this phishing and fraud is distribute malware. And you've probably heard about ransomware, trying to distribute ransomware and lock up computers and request a ransom, or malware and try to steal passwords and credentials, or trying to trick employees to transfer money, to buy gift cards, to transfer sensitive information. So cyber criminals realize that they can use phishing as a very effective method of pulling off their scams. And I mentioned ransomware. Cyber criminals are pretty smart people. In fact, they're some of the smartest people in the world and some of the most highly paid individuals in the world. And they increased their ransoms almost 150% in the beginning of this pandemic. So now a small organization, whether that's a small business or whether a small healthcare organization, is looking at about $45,000 if in ransom to get their data back if they become a ransomware victim. So if you take all of what's going on with lockdowns and pandemic and all the disruption, imagine that your organization gets hit with a $45,000 ransomware attack. It could be very crippling and you can have huge impact on your organization.
Yeah, absolutely. So what about a remote workforce? How has a shift to remote work created challenges for organizations and really given cyber criminals an opportunity to strike?
It really did, because you think about it, mid-March, we had all of these lockdowns in the various states, and employees were sent home, and still healthcare was still providing the patient care, and employees were still working, but now they're working from home. And although a lot of medical practices and small businesses and organizations are starting to open up, we believe we're going to see a hybrid is the new norm, where you're going to have some employees working from home, some employees working in the office. You're going to have employees working a couple of days at home, then traveling to the office. So we think that work from home and a remote workforce is going to be the new norm, where we're not going to fully go back to everyone being in the office. And that poses challenges. That posed challenge in the beginning of the pandemic, and it poses challenges ongoing. And some of those challenges are, we sent these employees home and we didn't train them. Okay. And, basically we said, okay, use this software and start doing your job. At the same time, as I mentioned, cyber criminals are using phishing and phone scams and text scams. So we didn't train employees on all of these scams and how to not be a ransomware victim. We didn't train employees on how to securely access company data or organization data. A lot of times we gave them equipment and we didn't train them on how to use it or had them use their own equipment. So, in addition, we also gave employees new software. Like we're using Zoom right now. A lot of organizations are using Zoom, and employees may not have been familiar, or they're using Microsoft Teams or some other collaboration tools. So one of the issues is we didn't train the employees on all of the scams and some of the tools that they're using. They're also distracted. It would be very hard to say that, everyone that's going through this pandemic and whether you're working at home or office aren't distracted. But, all of a sudden people are working with spouses or significant others or roommates. They're working with their children running around or their pets barking. They're working on a desk in their bedroom or down in the basement or on their kitchen table. And what happens is as employees and humans are distracted humans are humans that can easily be tricked and socially engineered. And when you're not really thinking clearly, you could fall for a scam. And that's what we're seeing. That's why a lot of the cyber crime that we're talking about has been successful, because employees are distracted and they're not taking the caution that they may have taken when they were in the office. In addition, there's inadequate security, whether they're using a laptop or computer that they have at home that may have malware on it, that may not be up to date with software. Their Wi-Fi may not be configured correctly. They may not have the software or the controls that they had in the office, and they're still accessing very sensitive information and PHI and patient information. And then also communication. Normally if an employee has a question, they get up from their desk and they walk down the hall and they stop in an office or stop at a coworker's desk. Now, when you're working at home, you don't have that opportunity. And also you may be using different collaboration software and you're not as comfortable. So if you put all of this together, the lack of training, the distraction, the inadequate security, and also the different mechanisms of communication, that becomes a real challenge for employees and also a challenge for healthcare organizations. And that's another reason why cyber criminals are being, so successful.
Yeah. So it's clear that COVID-19 has really increased the attack surface and given them a new way to target individuals and organizations. But what can organizations do to fight back against these scams?
Yep. I mean, the first thing is training. We're a HIPAA compliance company, and I can absolutely say annual HIPAA training is not enough anymore. Taking employees and training them on protecting PHI and how to disclose PHI is no longer enough. They need ongoing training. They need to know about, how to spot phishing scams, how to avoid ransomware, how to avoid text scams, and all of the methods that cyber criminals are using. Employees now need that ongoing training. And just like, when you were in school, the way humans learn is continuous ongoing training. Once a year training is no longer adequate. Employees need ongoing training, and it absolutely has to focus on cybersecurity. You also have to reinforce policies. Employees need to understand what the policies are, especially if they're working from home, in terms of what they should do with PHI or what they shouldn't do, maybe not copying it down to a local computer that may not be secure, not sending PHI via email or their collaboration tools. Also, you need to reevaluate your policies, because having HIPAA security and privacy policies are absolutely a requirement and needed, but you also need to look at policies around telehealth, which we'll talk about, social media, and all of these other tools that they may be using. And it's really important that employees not only know that there are policies, but they're trained in those policies and they understand the implications of those policies. The next one is really important: trust but verify. Humans are very trusting individuals, but this is a very dangerous environment where cyber criminals are trying to trick employees. They're trying to socially engineer employees to do something, to install malware, to transfer money, to give up credentials. So it is critical for employees and every single individual now to be suspicious. Be suspicious of emails, be suspicious of text messages, be suspicious of posts on social media, because there is so much misinformation and so much cyber criminals that are, or so many cyber criminals that are trying to trick individuals. You have to trust but verify. So, pick up the phone and call that individual that's requesting some information. Verify that what you're being asked to do, or your employees are being asked to do, is valid and they really should do that. And then also technical safeguards. Make sure that whether you're working at home or in the office, that computers are up to date with security patches, that antivirus and anti-spam software is up to date, that there is secure remote access, and that all of those technical safeguards are in place to protect patient information and to protect individuals from being a scam victim or a fraud victim.
All right, so now let's shift focus and start talking about telehealth and the surge in telehealth that we've seen since the pandemic began.
If there's one good thing that came out of this pandemic, I think it's telehealth. We have seen an amazing increase in a technology that that really was not used very, very much prior to this pandemic. We have seen an increase between 50 and 175 times the amount of telehealth sessions that that we saw prior to the pandemic. So that is an amazing amount of increase in a technology, and the reason is that providers look at this very favorably. They like the technology. Compare that to when EHRs were first rolled out. Many providers resisted EHRs and felt it got in the way of providing care while they're trying to record in their EHR. But now telehealth, with the technologies we have, providers are saying, what, this works. I can there's some things that I don't want to do via telehealth, but for the most part, I can have the conversation. I can provide care via telehealth. And 64% are saying, what, I feel comfortable using this technology. On the other side, that consumers and patients, they like it as well. I mean, as I mentioned before, 11% of consumers used telehealth prior to COVID-19 and prior to 2020. Now 76% of individuals say they are in favor of this, or they're likely to use this. So you have on both sides, you have providers and you have patients who like the technology. And another huge driver is insurance reimbursements are there. Insurance is reimbursing for telehealth visits. Before this pandemic, that may not have been the case. So you put together insurance reimbursements, providers liking the technology, patients liking the technology, and you have the reason why there's such a big telehealth surge.
Yeah, absolutely. 50 to 175 times more telehealth visits than pre-COVID-19. That's a really staggering statistic. So now that we're seeing more adoption with telehealth, it's important to remember that there are concerns with using telehealth as well. So Art, do you want to go through some of those?
Yeah. And one of the main concern is rush adoption. As I mentioned, before 2020, not many healthcare organizations were using telehealth. And then all of a sudden, in the middle of March, organizations scrambled and they said, we need to provide care. We need to do this. So there was really no planning. There was really minimal planning. Let's put it that way. And it was a free-for-all from a technology. What can we use to provide care to patients and one, provide care to patients, two, keep revenue coming into the business. We saw a lot of technology being adopted. At the same time, OCR put a temporary HIPAA enforcement discretion in place, meaning we'll allow you to use technologies that may not have been HIPAA compliant in the past because we feel it's important that you provide the care. So what we saw is that some of the platforms may not have been that secure, and we're probably still using it. Like we're using Zoom right now. Some organizations are using Zoom. Some organizations are using Facebook Messenger or FaceTime. And you know, that right now it's okay to use, but you know, that these may not be HIPAA compliant. And one of the things to really think about is the amount of sensitive information that could be in a telehealth session. I think it could be orders of magnitude more sensitive than what's in an EHR. But these are conversations that are between a patient and a provider. And we've heard of Zoom bombing, where individuals get onto Zoom meeting when they're not invited, and they potentially could eavesdrop. Or that some of these platforms allow for recording of these sessions. So think about a session recorded between a patient and a provider, and somebody, with a data breach accessing that information. So it's really a concern around the security. And if you look at how EHRs went, we put EHRs in because of meaningful use and all of the benefits, but then we saw the rush of data breaches and the damage and that could happen in a data breach. So I think it's really important that we look at these platforms and evaluate them from a HIPAA point of view and from a security point of view.
Yeah, so let's talk about that. Let's talk about how to address these concerns post-pandemic.
Yes. So the first thing is now is the time. I mean, as businesses are opening and medical practices are opening their doors again, we don't think telehealth is going away. For the reasons we mentioned, providers like it, patients like it, insurance is paying for it. So it's really the time to evaluate, are the tools that you're using today, are those the tools that should be used moving forward? Right. And eventually OCR is going to say, we're going to enforce, HIPAA again, and we're going to definitely look at the telehealth platforms and make sure that you're using HIPAA compliant platforms. Make sure that they're secure, that they have end-to-end encryption, that the provider of that technology will sign a HIPAA business associate agreement. Because any technology that is used that has PHI has to come from a vendor that will sign a business associate agreement. So it's really the time now to evaluate the platform, and some of the other pieces that you want to evaluate is, how does it integrate with my EHR? How does the data get saved or stored, and is it stored locally? Is it stored on a third party servers, and how is that data protected? So although we're using tools, the time now is to really evaluate whether the platforms we're using are the right platforms. And there's lots of different platforms, from EHR vendors, from standalone telehealth vendors, from healthcare insurance companies. So there's definitely no shortage, just like EHRs, there's no shortage of the different telehealth platforms. And really those evaluations should start now, and a migration to the platform that's going to be used moving forward.
Yeah, absolutely. And you may be using Zoom or a platform that does have a HIPAA compliant option, but it's important to make sure that you are using that option. It's typically a paid option. So it's just something to keep in mind. If you are on a platform that does have a HIPAA compliant solution, you just want to make sure that you are on that solution.
Definitely.
All right, so we're going to talk about some tips for safely using telehealth outside of the items we just went through concerning HIPAA compliance and things like that.
So, when you're thinking about new technologies, usually the use of technologies are in place before people realize how to use it, right? And the couple of things to think about is, when you're using telehealth, and make sure that you have to protect that patient privacy. Make sure that you're not in a room with people who should not be hearing this session. That you're not in Starbucks, and or in an office that non providers or employees are listening. Or if you're at home, spouses or children, they shouldn't be hearing. So you really have to ensure the privacy of that session. Also, make sure that there's guidelines around all of the protocols on how to use telehealth. So anyone who is using telehealth, whether that's a PA or a provider, they understand the configuration that they have to have in place. They understand what they should be doing with recording or not recording sessions, making sure that encryption is enabled and all of those pieces. So it's really important to put the operating procedures in place on how to use it. One of the things we recommend that, anything to do with today's environment, that cyber insurance is evaluated. You can't run a healthcare organization without malpractice insurance. You absolutely should not be running your organization without cyber insurance, because this is just more data that these criminals could potentially steal, and could wind up having a huge impact on your organization. The other thing is, from a patient point of view, you may have older patients, you may have patients that are not technology savvy. So it's really important to have a staff work with that patient, explain to them what's going to happen. Are we going to call you? Are you going to call us? What are you going to expect? And the more that you can make that comfortable for the patient, and the more that they are not surprised or concerned, they understand how this is going to work, the better that they'll feel much more comfortable. Also, it's important to disclose the risks, all right? Especially, if you're not using a platform that's HIPAA compliant, that is as secure as potentially the platform you may use in the future. It's really important to disclose that to patients and make sure that they consent, and we recommend a written consent, but at least a verbal consent. I understand the risks, and I still want to use this platform. So it's important. And the other thing is, as you use it, just make sure that you take best practices. As multiple providers are using it, or PAs or staffs, the best practices. Oh, I said this to the patient and they really enjoyed it, they liked it, and I calmed them down, and this was my best practice. So this is a new technology. It is really important to learn from our, not mistakes, but how we how we started using it and evolve. And just like, you evolved to as we treat patients in the office, this platform, I believe that as you use it more and more, you'll get better and better at it, and that will be widely adopted by patients, and also make providers feel more comfortable using this technology.
All right, that wraps up the presentation. Art, do you want to go through the key takeaways from our session today?
Yep, definitely. I've said this multiple times. Cyber criminals are not going away. This pandemic is still with us. They are going to leverage the pandemic. They are going to leverage, the news on treatments, on vaccines. You may have heard that there may be a presidential election in November. They're going to use that information. So all of this is just going to continue. There's lots of misinformation out there. There's lots of false information, and cyber criminals will use this, all of this environment that we have to continue to attack individuals and continue to attack healthcare organizations. As I mentioned before, employees need ongoing training. They have to know how to spot phishing and ransomware, and to tell the difference of real information and misinformation. That's very important. And the other thing is, eventually HIPAA enforcement will increase. So any tools that you're using for telehealth, for collaboration, for video conferencing, make sure that they are, will be HIPAA compliant, that they are secure, they use encryption, that those vendors will sign business associate agreements. And finally, it's a dangerous environment. And if you take some precautions, you can significantly reduce the danger to your employees and to your own organization.
All right, thank you. So we're going to pass this back over to Cindy to go through some additional resources.
Okay, thank you, Art and Nicole. Great presentation. Attendees, now's the time to type your questions into the Q&A box, and following the resources, you'll be able to, Art will and Nicole will answer them. So I wanted to tell you about some of the resources that we have on the AOA's website. These are our HIPAA privacy and security manual that is available for purchase up on the web address there. And then moving on, as Art mentioned in the beginning how COVID has affected so many of us out there, we wanted to make sure that the physicians knew that they were not alone. This physician support line was actually started by a doctor of osteopathic medicine. So please, if you're in need of some support, just someone to vent, whatever, give them a call. You're not alone. This is the page for the updates on the osteopathic website about COVID-19. This gets updated regularly, so please check back often. And then this is just a sampling, a small sampling of the on-demand COVID-19 webinars that we've done. And as you can see, they are on contract issues, moving your practice forward, health and wellness, telehealth, billing and coding. So there's a wealth of information out there for you. So please take advantage of it. And then we have a few webinars that are up and coming. Dates have not been established yet, but we do have the programs being developed. The first one is reopening your osteopathic manipulative medicine practice. This one obviously is specific for a DO, and we have had inquiries about this, so Dr. Brian Lovelace will be providing us with that. And then we have a series coming on medical practice operations, the Business Fundamentals 101. That will be, I believe it's an 8-series program. And then we have the Doctor's Ultimate Guide to Contract Negotiations. That one will be coming up in the future as well. And then as a reminder again, for the CME, following the presentation, you're going to go back to this AOA Online Learning at osteopathic.org. You'll have to sign in with your AOA credentials, or if you have not signed in before, you'll have to develop an account. It's okay if you're not an AOA member, the CME is available for anyone. And you'll go to your course, this course load in there, and that's where you will find the post-evaluation. And then the Physician Services Department, this is how you reach us. This is our direct line. So if you don't want to go through the main line at the AOA, this brings you right to the Physician Services Department. You can either call us directly or email us. If it turns out that your question or your inquiry is not regarding something that the Physician Services deals with, what we will do is we will triage that call or that email onto someone at the AOA that can help you. And then the next slide is basically how you can get in touch with, it's a download for the resource guide. This resource guide provided to you by HIPAA Secure Now will be available with the slides on the AOA's website. And before we go to the questions, I wanted to comment when Art mentioned cyber insurance. The AOA does have a relationship with Gallagher Insurance, and they do offer cyber insurance. So they are available on the member value page at the AOA's website. And then I also wanted to mention regarding the tips that Art and Nicole gave about the telemedicine. I recently heard from an audit friend of mine that the commercial carriers have started auditing the telemedicine claims that have come in. And some of the things that they're looking for, that they're asking, is for documentation on what device was used for the telemedicine visit, as well as if it was HIPAA secure or not, and if it was not HIPAA secure, if there was documentation that the patient was notified. They've also told my friend that they would reach out to patients as well. So just wanted to put that out there that it is happening.
That's interesting. Interesting to hear that auditing is going on.
Yep. Okay, and Nicole, I'll turn it back to you for questions.
All right, let's take a look here. So the first one is more of a comment, I think, than a question. It says, PHI is significantly more valuable to cybercriminals than a credit card number.
That is a very true fact. In fact, to tell you the truth, there are so many data breaches that, and there's such a, if you had economics and supply and demand, that credit card information, the value of credit cards have plummeted down to under $1, to sometimes at pennies, where it's just so difficult to use that credit card and monetize that. But PHI is extremely valuable. There's so much, you think about PHI and all of the information you have with patients, and that could be used for insurance fraud, that could be used for financial fraud and opening accounts, and that's why cyber criminals are targeting healthcare. I have said it multiple times, and it's really true. It's because healthcare is so rich with information on individuals that can be used in so many different ways. So I hate to say it, but healthcare has a target on your back, on our back, and it won't go away. And unfortunately, historically, healthcare has not been a very secure, vertical or industry. So, cyber criminals know this. They know that, from a security point of view, there's weak security, and also that there is a ton of valuable PHI, PII, and that could be used to make a whole lot of money. So that was a very good comment. I appreciate that.
Yep. And then we have a question: is DoxyMe HIPAA compliant? I can answer this. I just took a look on their website actually and found their question section that talks about HIPAA compliance. So they say covered entities using our platform are compliant with HIPAA, and they do list quite a few reasons why they are HIPAA compliant. I'm just going to highlight a couple of the big ones that caught my eye, but they don't permanently store protected health information. They operate according to privacy and security rule. They conduct their risk analysis and management. They sign a business associate agreement. So these are all things that you should definitely look for when considering a telehealth provider. But yeah, from what I can see, DoxyMe is definitely HIPAA compliant.
And, it really gets, as a platform, and it was kind of interesting, the first words that you read off of that. As a platform, they may be HIPAA compliant, but it also depends on what you do with that platform. As I mentioned before, just using DoxyMe and you're around individuals that shouldn't be hearing this conversation, then even though the platform may be HIPAA compliant, you're not using it in a HIPAA compliant manner. So it's very important to evaluate a vendor for, what Nicole just read. How do they protect that data? How are they protecting the infrastructure? Will they sign business associate agreements? Are they using encryption? And also will they integrate with your EHR? So, talking to other providers that have used that platform is very important. So these are big decisions. I mean, when we saw EHRs be implemented in the beginning, that a lot of those initial EHRs were ripped out and replaced, and that's a very expensive ordeal to go through. So it's very important to take a lot of time to evaluate the right platform. Thank you for the questions.
Yeah, thank you very much.
And again, thank you, Art and Nicole. Any attendees, if you have a question that comes up after the fact, please don't hesitate to send it into Physician Services and we'll be sure to get it answered. This concludes our presentation. However, if you'd like to stay on to listen to the services that HIPAA Secure Now offers, they are going to just do a short little intro to them. So I'll let you move on, Art. Thank you.
All right, sounds good. I only have one slide, and I just wanted to say that, HIPAA Secure Now has been in business for 10 years, since 2010. We have helped healthcare organizations with HIPAA compliance and protect patient information. We have worked with OCR and CMS on audits and HIPAA investigations. And our services are, we provide ongoing HIPAA security and privacy training. We provide ongoing cybersecurity training, simulated phishing, all of the things that I mentioned about how to protect patient information, how to avoid cyber scams and COVID scams. We provide that cybersecurity training. We have HIPAA privacy and security policies, as well as cybersecurity policies and social media policies and work from home policies. We provide help with security risk assessments, for HIPAA compliance and also for MIPS and MACRA. We are an outsourced HIPAA help desk. So if you have any questions around HIPAA, we're there to provide help. Our platform is a repository that you could store business associate agreements and all the policies, and we provide cyber insurance, as well as we help organizations prove that they have taken HIPAA seriously and are performing all of the requirements that are part of the HIPAA security and privacy rule. So we've worked with many thousands of healthcare organizations, from single providers up to large healthcare organizations. And if you have any questions, you can email us at info@hippasecurenow.com. Be more than happy to answer any questions and help you as well. And I just want to say, Cindy, thank you very much for inviting us today, and we appreciate the opportunity.
Thank you again, Art and Nicole. Great information. And,
Thank you, Cindy.
Thank you. Well, a comment came in that HIPAA Secure Now is a fantastic organization. So I agree.
Thank you.
Thank you.
Thank
All
you.
right. Have a good evening, everyone. Good night.
Bye.
Bye.